Ever heard about DVT, that is deep venous thrombosis, also known as thrombosis? So let's see what is it about, and what are the treatment options. It is usually seen in patients having post-operative immobilization, prolonged bed rest, or of the age more than 40 years, or having MI, or having any disease. These people are prone for having DVT. Coming to the clinical features of these patients, they'll be having pedal edema, erythema of the limbs, dilated veins, and mild fever can also be present. Now, there are two signs to detect DVT. Number one is Homan's test, and number two is Mosses test. Homan's test, when you press forcefully the dorsiflexion of the foot, there is a severe pain in the limb. Number two, that is the Mosses test. In this, when you press your calf muscles from side to side, you will be having a severe pain. So these two signs or these two tests are used for DVT. Lab tests for diagnosing DVT are color Doppler, in which they use sound waves of various wavelengths and then they detect the blockage in the veins or the vessels. Number two is contrast venography, in which a contrast medium is injected in the vessels and blockage is detected in it. Now, coming to the treatment options, one of the most important treatment options is bed rest and leg elevation, which will prevent the pooling of the blood and thus prevent from thrombosis. This is the most important step which you need to do if you're having DVT. Number two is injecting heparin. 10K of heparin is injected with a continuous infusion of 30 to 40K of heparin for 7 to 10 days. And then oral anticoagulants, that is warfarin, like blood thinners, are given, which are to be given at least 2 to 3 days before stopping heparin, as it takes time to act. This is the second option, giving anticoagulant therapy. Number three, and the last option, is surgery. There are two kinds of surgeries available, that is Palma operation and Mayhusny operation. In Palma operation, the femoral vein of one limb is connected to the femoral vein of the other limb. And in Mayhusny operation, the popliteal vein of the same limb is connected to the saphenous vein of the same limb. So these two options are the surgical options for DVT. Now we are done in short about DVT. Now you have to tell me what is Virchow's tribe for thrombosis. What are the three important points in comment section? Thank you and follow for more.